Okay, hello everyone. Today our topic of discussion is what are the causes of tubal blockage. So first we should know what is the function of the fallopian tube. So fallopian tube is attached to the uterus and it helps to move the mature follicle when it gets ruptured toward the uterine cavity. And if the female is having a relation that time, or we do the procedure like a IUI, or we do the procedure like OITI, means time intercourse, when we suggest the patient after the rupture of the follicle. So the fertilization, the process which is the most important for getting the pregnancy, it happens in the fallopian tube. So this itself tells us the importance of the fallopian tube when the couple is trying for the pregnancy. So when the patient comes in the infertility center, so first and foremost we see how's the follicular quality, how's the AMH, and the second most is the tubal function. Tubal function is the most important part to assess the infertility part. So there are certain reasons also when we see the young patient, they come with a report that they're having a tubal blockage. So we know the main function of tube, fallopian tube, is for the pregnancy, because the site of fertilization is the fallopian tube. So there are certain causes which causes a fallopian tubal blockage. The first and foremost we call it as a PID, that is a pelvic inflammatory diseases. So when there is any infection, chronic infection like a chlamydia infection, because certain women, they have a complaint of recurrent vaginal foul smelling discharge. So that can also point out that patient is having some PID. They are having a chronic pelvic pain inside their pelvic cavity. Second, if there is a tuberculosis, which is the most common in India, this tuberculosis bacteria, it also causes a adhesion. It also causes a tubal blockage. Certain other reason is like a endometriosis. In endometriosis, what happens? There are multiple adhesion get formed, and because of that, the tube, they got attached to themselves and there is a adhesion, and it will causes a blockage of the fallopian tube. So first cause is the PID. In PID there is a various bacterial viral infection and the tuberculosis, which is most common in India, which causes a tubal blockage. Third cause is the ectopic pregnancy. Suppose any woman, she had a previous history of ectopic pregnancy. So because of ectopic pregnancy, sometimes we do the tubal milking is done, or sometimes the tube is removed. In that regions also, or fibrosis occurs after the ectopic pregnancy. It get over after treating by the medical treatment. Because of that fibrosis also, there is a tubal blockage. Fourth cause is a fibroid. The fibroid is nothing but a benign tumor, but sometimes it also causes a tubal blockage if there is some subserosal big fibroid is there and it is compressing the fallopian tube. It causes a blockage of the fallopian tube. And the last is the, if any previous abdominal surgery is there. Certain Sometimes it happens ki if young lady is there and she had a appendicitis or any appendix operation or any abdominal surgery in the past. So because of the surgery, there will be the adhesion, and this adhesion causes a tubal blockage. So most five causes, whenever any patient comes with a tubal blockage, we keep in a mind, which is the infection, PID, endometriosis, fibroids, post-surgical, and the ectopic pregnancy. And how we come to know whether the tubal blockage is there or not. So tubal blockage we can check mainly by the two tests. One is the HSG, that is called as a hysterosalpingography, and second is SSG, that is a sonosalpingography. So what is the difference? Difference is that in HSG, the patient it is not under sedation. We don't give any anesthesia. This procedure is generally done by the radiologist because it requires X-ray machine. What we do in the uterine cavity means after the menses get over, after day 4 or day 8 of menses, in between that only we have to do the HSG. So in that the patient is called for doing HSG. We put a dye, and that dye we put inside the uterine cavity. If that patient is totally conscious, a little bit of discomfort is there, obviously, because that dye is a foreign body, so it causes a cramps inside the uterine cavity also. And we do the X-ray. If and the report comes immediately in X-ray. If the fallopian tube looks normal, the spillage is seen in that X-ray report. So we label patient that she is having a normal tube. If there is a no spillage, that means the tubal block is there. There are two. Means sometimes there is a corneal block is also there. Sometimes if patient feel extreme pain, that time there is a spasmodic blockage is also there. So in that second way, which I told, that is the SSG. SSG is nothing but a sonosalpingography. The advantage is that the patient is under sedation, so there is no any pain. Only the thing is the patient has to take a anesthesia, which is a very minimal anesthesia we do. Hardly for 5 to 10 minutes the patient got unconscious, and in that we don't use a dye, we use a normal saline, and we put it inside the uterine cavity and see the bubbles. If on a both sides the free spillage is seen, that means your tube is open, and if the spillage is not seen, the tube is blocked. And the third test, that is the most we said it as a gold standard test, that is a diagnostic laparoscopy. So suppose any patient is coming to me with a HSG report of corneal block, or sometime with some full single tube block. So that time the step is कि we tell patient to do the diagnostic lab, because the advantage of diagnostic laparoscopy is that because it is called gold standard, because it will give you the assure result, because in HSG or SSG the report can vary according to the person who is reporting that. Okay, but in diagnostic lab we can do the repair at the same time. If suppose there is a corneal block, we can do the tubal flushing that time. If there is a adhesion is there, we can do the adhesiolysis, because of the adhesion if the tube get squeeze on means it get added to some organ. So that time we do the adhesiolysis and the tube get free, and it will be the functional to that patient. Sometimes in diagnostic laparoscopy also we can do the tubal recanalization also. If we see if the little tubal blockage at the end is there, so with the help of guide wire we can do that also, means little bit of recanalization is there. And one cause which I miss during telling of tubal blockage is the family planning operation, because certain patient, it is very rare, but certain patient they came means because of some accidental death of child, means when the woman got early marriage and they finish their families, complete their family, they do the tubal blockage, and certain accident happens and now they are not having any single child or any child. So that time they request for कि madam हमारा family planning का operation खोल दो. So that procedure is called as a tubal recanalization. When, because in family planning operation what we do the clipping of the fallopian tube so that the pregnancy doesn't happen. So in tubal recanalization, whatever the portion of the fallopian tube is remaining, we try to join it. Only the side effect is that कि because of the tubal recanalization, or we say any tubal procedure when we do, there is a chances of ectopic pregnancy. Ectopic pregnancy is a very dangerous condition. If it doesn't diagnose on a time, a woman can get die also. So that is the reason when we tell tubal recanalization, and there should be always a counseling should be done regarding the ectopic pregnancy, because when any tube get repaired, there is a chances that that fertile embryo or that embryo get dislodged in that fallopian tube. So that is the thing. And when tubal blockage is diagnosed, so the treatment I told ki we can do tubal flushing, we can do adhesiolysis, we can do tuboplasty, we can do tubal recanalization. But all these procedures which are related for the tubal blockage having a major risk of the ectopic pregnancy. So what is the best without any risk of ectopic pregnancy for the patient with a tubal blockage is the IVF. IVF is the main solution for this kind of a patient, because what happens, we make an embryo outside and we put it directly inside the uterine cavity. So there is no role of any fallopian tube, and patient get conceived also, and there is a very minimal, means I can say 0.01% chances after IVF pregnancy the patient get ectopic pregnancy. Okay, so the conclusion is the tubal tests are the important part of the Evaluation of infertility. Not all tests have the same accuracy, like HSG, SSG, or a laparoscopy. These three tests doesn't have the same accuracy. Obviously, laparoscopy is the gold standard because in the same sitting we can repair the damage. We can repair the damage like doing adhesive lysis, and we can confirm it. Yes, the tube is blocked. And tubal repair is a successful, but it is in very few cases. If suppose I do 10 cases of tubal recanalization, hardly one patient can get pregnant naturally after doing the recanalization. Plus, there is a associated risk of the ectopic pregnancy. So, the final answer for the tubal blockage is the in vitro fertilization, because in that we directly put the embryo inside the uterine cavity. If anyone having a question related to the tubal blockage, please message me. We can discuss here. Okay, could have been born with a block or damaged fallopian tube. See, since birth we don't know whether the tube is blocked or not. But the thing is that sometimes it happens if there is any Mullerian anomaly, because when the uterus get developed, and sometimes it is very rare patient can born with a damage or absent fallopian tube. We can say one side of uterine cavity doesn't develop, or one side of fallopian tube is not there, or one side of ovary is also not there. So that can also happen. Are fibroids or other growth possible cause of my TB blockage? Yes, definitely. Fibroid or any growth we can say, like the polyps or even the endometriotics, the endometriosis when it is there, this all causes adhesion, and this hamper the physiological process of the fallopian tube, and it causes a tubal blockage. Okay, anyone having questions, so please reach me on this number, and we will definitely help you with a tubal blockage if anyone is having. Thank you so much.